You work at an emergency department. Mom brings baby in. Baby had a seizure at home just once. It lasted about 10 seconds. Mom got nervous, brought baby in. Baby's presenting to you as this. Baby's hooked up to the monitor, heart rate of 121. That's about as far as they got before you walked in the door.
Okay.
So, what do you want to do next here?
Check baby's temperature. Make sure.
Baby feels warm to the touch. Baby is
Check the SpO2.
very flush. SpO2 is okay, 98%. Or I'm sorry, 94% at room air.
So he's already hooked up to the monitor.
And they pop some oxygen on him. He's on some low flow, blow by 98 now.
What kind of temperature? Temperature said fine.
His body temp is 99.4 right this second now. He's very, very warm, you kind of feel.
Yeah.
When he first arrived, they originally took his temp in triage at 98, so he's increasing. Mom didn't give him anything for his temperature or anything. He's been running warm for the last couple days. Baby hasn't been taking in too much fluid, been peeing somewhat okay, had a few stools, but hasn't been eating that well. No other medical history. Otherwise, like right now, baby's just laying here, kind of just tolerating the blow-by oxygen. Mom's right next to him, so he's not crying yet.
So baby's had this for a couple days. Ask mom a couple questions.
What else do you want to do to help make this, to help bring this patient's temperature down?
Take the blanket off.
Perfect, you could do that. But baby's still warm.
Probably give him some.
Okay. Doctor orders some Tylenol after you suggest it to them, since the doc hasn't been in yet. What other things could you do to help baby cool down a little bit more?
Not an ice cold, but a cool, wet towel.
Perfect. You put a wet towel on, help cool baby down a little bit. While you're working on getting that wet towel on, baby starts seizing. What do you do? The other nurse came in, started an IV, so you do have IV access. The physician is busy with a cardiac arrest going on next door. So you're the provider in the room right now. Yep. How much Ativan do you have?
0.1.
Patient weighs 11 kilos. How would you want to figure out for how much your dosing?
Well, they have those Broslo tapes I could look at.
Perfect. Broslo tape says he's green. Green.
Very low dose.
I think it's 0.01 milligram per kilo. You figure out your dose, you give him the Ativan, stop seizing. What else are you going to want to monitor now? Post-seizure.
Heart rate, temperature, put that on, oxygen.
Yep. You keep the oxygen on. He's still tacky. He's more lethargic now after giving him the Ativan and after his seizure. He's got the Tylenol in. You're still actively trying to cool him down a little bit. What other questions would you want to ask Mom?
If there's any history in the family of seizures or anything else.
Mom says there's no history of seizures in the family. Mom tells you that he was a preemie though. So with that information, you would want to try and ask her more questions if everything went well after he was born, if he did have any oxygen issues or anything like that. But you're going to just want to really monitor and watch him after that seizure, just to keep track, make sure he doesn't have another one.
monitor.
You want to cool them down, that's it.